Welcome everyone to tonight's workshop on the truth about shoulder pain. Looks like I've got this on the wrong slide. We'll get to that slide, but let me move this up, go to the lead slide, and we're going to get started tonight. Our workshop tonight hopefully is going to be about 45 or 50 minutes in length. My name is Troy. I'm with Kinetic Edge Physical Therapy. I love interacting with people. When we do these in person, it's really easy to do that because we're in the same room and it's easy to talk that way. But we do have ways of interacting. Some of you have already done this. That chat icon is something that you should be able to click, and everything you write in there gets seen by me only. Not any other people will see it too. I will also give you my personal contact information. So if you need to reach out afterwards, I welcome you to put whatever questions you have on the chat tonight. But in the middle of this presentation and workshop, there's sometimes a lot coming in and I can't catch them all. So I promise I will get back to you if I don't get to you in the middle of today's session. Very, very briefly, why in the world would you want to listen to me? So let me just tell you a little bit about myself and then we'll get past this. But I'm a proud graduate of the University of Iowa, as I just told Kathy, has a very good physical therapy program. And I felt like I was very well prepared, but that was way back in the 1990s. I've been practicing for over 28 years. I've since got my doctorate from a group out of Louisville, Kentucky. And even though I felt that I've been prepared really well with my education, what you're going to learn about tonight are the things that I've learned for 28 years as a physical therapist, including the last, it's almost 24 now, with Kinetic Edge Physical Therapy. Our practice is in central and south central Iowa. We've been around for over 25 years. And I don't know if this will surprise you or not, but the most common condition that we help people with is lower back pain. But second to that are shoulder problems. They are really common. So maybe that's consolation for you. If you've been dealing with shoulder pain, you are certainly not alone in that. There's a lot of people that deal with this stuff. And I'm excited to tell you about things that I've learned through 28 plus years of helping all kinds of people with shoulder pain issues. Just today, I had about 12 people on my schedule, and I think a third of them were shoulder pain related issues. So I'm learning still to this day. And you're not going to get tonight just what I've learned. I'm one of about 40 PT providers in our practice. We are all very well versed in what's called 3D movement analysis, maps, 3D maps kind of stuff, applied functional science. We're going to talk a little bit about this tonight, but let me give you a little bit of a glimpse as to what that really means. It's a fancy word that says your shoulder is not does not exist in a vacuum. It's a part of a dynamic system. It's interconnected with a lot of other body parts, and how your shoulder functions is dependent upon what's happening within that entire system. So we're going to talk about that whole system tonight and how unlocking issues elsewhere can help you function better and take the pain away from your shoulder. So this is the time to give me a little bit of feedback here. I'm going to ask you to answer, if you could, in that chat icon, chat box. The first question is the most important. Is there a specific activity, action, motion, position that bothers your shoulder? Because your answer to that question is going to help me understand whether or not what we're going to talk about is going to be helpful to you. Now, if you want to give me more details, the next two questions are interesting. How bad does that pain get on the 1 to 10 scale, with 10 being emergency room pain? Get me there right now. Almost unbearable. And then how long have you been experiencing it? Now, the answer to those other two questions, how bad is it and how long you've experienced it, doesn't really tell me if I can help you, but it may give me some indication as to how long it would take to make it well again. That which is more significantly painful and has been around for a longer period of time is generally going to take a little bit more time to reverse. That's kind of a good general rule. But the real important question is, what activity makes it worse? So we're getting a few people to respond here. Kathy, you are the first again. Laying on your side. There you go. And that pain gets to be an 8. It can freeze at night. This is the result of an injury in 2014. There you go. Janice says raising her hand began about 6 weeks ago, and it can get up to an 8. So that's kind of a mixed bag there, Janice. It has not been around terribly long, which is a good thing. 8 out of 10 is not a minor thing, though. It's pretty significant pain, but I'd still much rather have something that's been around for 6 weeks as opposed to 6 years, or in Kathy's case, 11 plus years here potentially. Okay. But, and more people are indicating this too. Let's see, we've got John G saying reaching. We've got Janice saying that laying in bed at night, it hurts her. We got Joe saying laying on his side, 7 or 8 in about a month. Again, pretty high levels of discomfort, but only a month is really a good thing. That can usually be helped pretty well. Joy says lying on her side. So we've got a lot of side people. We're going to talk a little bit at why nighttime and horizontal positions can be hard on the shoulder yet tonight. Good. So many of these same things are coming through. Lisa says typing at work, 2 to 3 months. That again is pretty good in terms of length. Great. I'm gonna go to this next slide because I think you're gonna find it interesting. Most of the things that you guys have been saying, I kind of predicted because this is what I hear all the time. These are the things that generally reproduce pain, but it's kind of weird to hear it said this way, but it's true. If your pain is reducible, that's actually kind of good news because if your pain is reproducible, it's also reducible. If something makes it hurt worse and eliminating that something makes it feel better, we know that there is a mechanical issue at play here. So what in the world do I mean by a mechanical issue? Well, I might be jumping ahead just a little bit here, but it feels like a good time to tell this story. Imagine a perfect spring day. Okay, so sunny, not too much of a breeze. It's so nice. You get your convertible out and you go for a beautiful ride. Okay, you're riding along the countryside and this little light comes on your dashboard. Okay, what do you do when that light comes on? Well, if you're like me and most other people, you're probably saying, that darn light, it's not reliable. I don't see anything else going on. I don't hear anything. It's not a problem. Okay, it's a faulty light. That's the issue, which in some cases is really true. So if you're like me and that light comes on, you're probably going to still drive. And most of the time that goes okay. But just imagine in this particular case, you're driving along, and not only does that light go on, but several miles down the road, you start to feel it rattle. There's a little smoke coming up from under the hood. You're smelling something funny. More signs of pending problems are becoming noticeable as time goes by. Now, what would happen if I did this? I pull along the side of the road because I see lots of side issues. I pop the hood and then I also pop the trunk because I know that in my trunk I got this thick old blanket. So I walk to that trunk and I get this blanket and I throw it on top of the engine compartment and I slam that hood back down. And then I go back into the seat of my car, open up my glove box because there's a little piece of duct tape there. I can get a duct tape and I can cover up that light on the dash. Now I can see no evil, smell no evil, hear no evil. All is well, right? Well, of course not. I didn't solve that problem. There's something mechanical going on, and I just covered it up. Then think about what this analogy really means when I'm talking about, in this case, shoulder related issues. This is what people do. When something hurts, they try to avoid the thing that hurts. They tell themselves it's going to be all right. They either ignore it or they start taking pain medication, those kind of things, all of which might make it feel better for a little while, but it doesn't acknowledge the fact that there's a mechanical issue going on. And we know that if there's a certain motion, position, action, activity that makes it hurt worse, there is something mechanical going on. You have to fix the mechanical issue. So before we go too deep into that, I want you to learn a little bit about this word called trauma. When you hear the word trauma, what immediately comes to mind? Most people will say things like a fractured bone or a motor vehicle accident or a fall from a height, hurting myself. Those are all definitely traumas, but not all traumas are alike. What I just described there, what's most common when people think about trauma is called acute trauma. That means sudden trauma. That trauma looks like this: sudden tissue damage, followed by time, whereby the body recovers, restores, goes through a correction process. Because acute trauma is the result of one incident, one stressor that's significant that creates tissue damage. When that stress is eliminated, the body naturally goes through a healing process. And in most cases, unless it's a really substantial trauma, we're going to heal to the point where we start to feel better. It gets below that symptom threshold. That's a reality. We see these kind of issues in our clinic quite a bit, but it's not the most common type of trauma that we see. The most common type of trauma are people that come to me saying, yeah, I was working and my back kind of tweaked and it's gradually gotten worse. Or, I was painting, my arm was overhead and I could feel it in my shoulder a little bit and I thought it'd go away, but it's not going away. Those aren't acute traumatic incidents. Those are probably cumulative trauma issues, and cumulative trauma looks different. Slowly but surely over time, the body's tissues change. And you'll notice that at the start, below that symptom threshold, at the start of that upward arrow, changes are occurring. We just don't feel it yet because it's below the symptom threshold. And when it gets just above that symptom threshold, we're starting to feel it. But most people are going to say, it's not that bad. I don't want to be a squeaky wheel. It's not there all the time. I can deal with it. It's going to go away, because people like to ignore those kind of issues. But all too often, if you're still exposing yourself to the same physical stressors, little by little, over and over and over and over and over again, the tissue continues to change. And as a result, those signs of issues become more significant, more pronounced, more obvious. Now, why do I have these buckets on here? Well, let's go through this bucket analogy with regard to cumulative trauma. Though cumulative trauma can be very slow and insidious in developing, it's also quite kind of predictable. And if you look back at something that's gotten worse over time, you can probably map the same process in your life. I'm 53 years old. More than half of my life, I've been a physical therapist. Being a physical therapist is great in a lot of ways. It's not physically demanding like some work is. But I will say, today, after half my life of doing this, when I get to the end of the week, I'm more tired today than I was when I was a young physical therapist. And when bodies age, when they experience stress over time, the first thing we notice is fatigue. Fatigue is a sign that we cannot handle what we used to be able to handle before. We know that we are aging. We know that time eventually wins out. And so most people say, yeah, I get it. I'm not a spring chicken anymore. I get it. So we just continue to do the things we've done before, ignoring the fact that our bodies are changing. And when more water fills that bucket, we're doing things and catching water. As it gets to the next level, it's no longer just fatigued. Discomfort I best describe as a little stiffness and a little soreness. It's not significant pain, but it's not just fatigued, right? These kind of people, they need to warm up a little bit more to get their bodies going, or they need more recovery. People that work in manufacturing environments, I hear this all the time. By the end of the week, it's really difficult. Then the weekend comes, I recover, I'm feeling pretty good. Then I wake up Monday and I do it all again. And by the end of the week, it's gotten worse again. But still at this stage, many people kind of ignore what's happening and just trot onward with this, and more water fills their bucket. And eventually, in many, it will pass from just stiffness and soreness to real pain. This is a different level of symptom altogether. And the next step is dealing with the mess of that bucket overflowing, true tissue injury. And so my goal is to help you move this way, okay? Open up the valve to let some water out, build your bucket up. We need to create gap between the top of your water and the top of the bucket. We want you to get to the point of retirement and beyond well, so that you can function as well as possible. That's what tonight is all about. Here's another analogy for you. Imagine you're walking on some old train tracks and you think that they are a defunct rail line. But eventually, as you're walking along these tracks, in the distance, you start to hear these little signs of a pending problem. Maybe the tracks start rattling a little bit, a distant train whistle on the horizon. If you look carefully, that train starts to come around the bend. And the closer that train gets to you on the railroad track, the more significant the signs of pending doom are going to be. It becomes more frequent, more intense, greater in duration. That's what happens in your shoulder. That's what happens with musculoskeletal issues as that cumulative trauma, because of exposure to repeated stressors over time, builds. That pain becomes more frequent, more intense, longer in duration. And here's a really important point. When we hurt doing something specifically, we do that thing less. And ultimately, what pain does is it causes us to move less, and move less, moving less, though it might temporarily make us feel a little bit better in the area that's bothering us, definitely is not the solution. It leads to worse overall general health. I didn't even include that part on there, but I think 83% of the American healthcare dollars come from 6 issues. And I think I can even remember them in order. Musculoskeletal issues are the easiest, the number one healthcare spend in America. It actually is more expensive than the next 2. The next 2 are, I think, diabetes and cancer. Yeah. And then you have obesity, Oh no, it's heart disease and cancer, then it's obesity, and then it's diabetes, and all those things, except for cancer, are negatively influenced by how well and how often you move. So the answer is never to move less so you hurt less. The answer is how can I move better and move more often without creating an irritation? Remember, this is a mechanical issue. Okay. Now I've alluded to this a couple times already, but the way people respond to problems, especially in the early stages, is also very predictable. I'm sitting in the newer part of a 110-year-old home. When we moved in here 10 years ago, we were told by our insurance adjuster, we will cover you, but not that roof. You need to get those shingles replaced. They're way too old. And I looked at this old home that had a pretty big roof, and I said, boy, that's a lot of roof. That's probably going to be painful. It's probably going to cost quite a bit. So I ignored it, and I continued to ignore it because I looked at my ceiling and said, you know what, doesn't look too bad. It's doing just fine right now. Now, I'm not going to lie to you. I several years later got it fixed, and I dealt with the pain of paying for that. However, I was kind of rolling the dice. I was gambling a little bit because I was at greater risk as time went by that something more significant was going to happen that was going to be even more costly. I ignored it for as long as I possibly could. Now you're no longer in this boat. You're beyond step one because you're here tonight. You are not ignoring it. You're interested in finding out about this thing. The next stage, in most cases, ultimately, unfortunately, isn't a true solution. Most of the things we do initially when we try to seek solutions to the problem don't really get to the root of the problem. They just kind of alter it, they mask it. So think about medications, injections, and surgeries. They might deal with the ramifications of a mechanical musculoskeletal issue, but it doesn't ask the question behind the question, why did that thing develop in the first place? And have I fixed that? Because even if you clean up that thing with a surgery, even if you tamp down the pain response with a particular medication, if we've not eliminated the mechanical stress on that tissue, the weed still exists. So my challenge to you tonight is to pull that weed out by its root, get to the root of the problem and solve it. And I'm going to tell you something today. You're going to hear lots of really common sense things that I think will make you nod your head. I think you'll say that makes total sense. Why haven't I heard it that way? But here's the issue. We're going to talk about things in a general sense. I cannot tell you your specific root issue without giving you an opportunity to learn that with a one-on-one consultation. So that's coming up later. For giving me your time tonight, I'm going to offer you a free gift and opportunity. We'll talk about that in a little bit. Let's get back to this point about mechanical and contrast the mechanical with medical, right? So if you think about the shoulder as a medical issue, on the surface, you say, well, that totally makes sense, right? Oh, we got all these medical doctors that help us with these things. There are shoulder specialists. Clearly, it's a medical issue. But I'm here to tell you tonight, it's more of a mechanical issue than it is a medical issue. And what I mean by that is this. If you lift up your shirt sleeve and you take a look at that thing, there's not a dial on the side that says, look at that, I am low on ibuprofen. If I just pop the pills, take that medicinal approach to it, that's going to take care of that problem. My dial will move up and I'll be just fine. Now, you can't successfully manage a mechanical issue, something as a result of repeated cumulative wear and tear, with a chemistry treatment. These are movement-based issues that to get to the root of it, you need to solve a movement problem. You need to go to someone that understands whole body functional movement to take the stress out the tissue. One other very brief explanation to challenge the way that you and everyone in America thinks at this point. If you hear that you have something that's inflamed, what is your natural response to that? Okay, you can't really talk to me right now, but I'll read your brain. Most of you are saying, well, I can take an anti-inflammatory for that. We've been conditioned that we've got medicines. Even if you take ibuprofen at a high enough dose, that's an anti-inflammatory. You can get a prescription non-steroidal anti-inflammatory. Will that make me feel better? Yes, it probably will. But I think we need to understand that inflammation is the normal part, any normal part of a healing, natural healing process. It is, as you see, phase 2, from about day 3 to the end of week 3 after an irritation of a tissue, some kind of damage or wound to a tissue, we are in the inflammation phase. Okay. And during this phase, the body is preparing at the early stages a new framework of blood vessel growth. And what do blood vessels do? Blood vessels clearly distribute blood to the body's tissues. That's really important because it has oxygen and all these other important nutrients that we take in through the stomach and get dissolved into the bloodstream to keep our tissues healthy. So if we take an anti-inflammatory, we're stopping a natural part of that healing process. And we want that inflammation to turn to proliferation and eventually maturation, where that tissue is well inundated with vasculature to feed the nutrients to that tissue. Stopping that process might make it feel better temporarily, but it also stops the process that brings better nutrient delivery to those tissues. And I'm going to challenge you to say, we don't want to stop that process. We want to feed that process. Okay. Let me tell you a quick story about John. This is not his real picture, but it looks very much like him. As a young physical therapist over 20 years ago, I was in Eastern Iowa, and John came to me, a 92-year-old guy, a very spry, active, clearly thinking really well. But he said, I cannot raise my right arm. And I said, well, that's not good, John. And when he told me more about the story, he said, it's hurting for a long time and I just can't move it very well. I went in and I got medications. That didn't really help me that much. We eventually did an MRI, and it's a massive tear of my rotator cuff, is what he told me. He said, the doctor said we can do a surgery, but he didn't really want to do it because of my age, and I don't really want to do that either. I just want to be able to lift my hand up to get something out of the cupboard and be able to fix my own hair. So he had a great attitude. He said, I don't know what you can do, but I want help. And I said, honestly, I said, John, I'm not sure what I can do either. I know I can't make that rotator cuff repair. When it's damaged, it's damaged. However, I do know that your shoulder is connected to a lot of other parts. And if we get all those parts moving as well as possible, let's take advantage of what you're really good at and let's maximize that. And I'm hoping that we can help your shoulder feel better and function better. And to John's credit, he worked hard for about 8 or 10 weeks, a couple times a week. And we started with the easy stuff and gradually worked. And then by the end, he said, my pain is about 75% better. I can lift my arm twice as high and I can do everything that I want to be able to do. I am really satisfied with this. So, and I confided to him at that time and I said, John, you've done better than I anticipated. So I'm here to tell you, if you're dealing with those kind of issues and you're not 92, you're younger than this, it can take some time. 8 to 10 weeks in John's case wasn't even as long as some of them can take. But he looked at the bigger picture and we helped him function beyond just the shoulder. And pretty soon his shoulder, collaborating well with the neighboring body parts, tissues, and joints, did really quite well. And I think that's key, is to figure out how to take advantage of what you can do and make sure that your shoulder is being befriended well by good, close neighbors that do their job as they should. All right, let's get into the nuts and bolts. I'm going to start by talking about most common types of shoulder pain. As we do that, I want you to understand what the shoulder is. The shoulder is actually made up of 4 different bones, believe it or not. You got your upper arm bone, the humerus. You got your scapular shoulder blade. You got your clavicle, and then actually your sternum is a part of that whole complex as well. So 4 bones. The rotator cuff, you've probably heard of before. There are 4 rotator cuff muscles, all of which start or originate from the shoulder blade and connect to the top of that arm bone. Most of the issues that occur in a shoulder are occurring in this area right here. I hope you can see my cursor. I don't know if you can or not, but this is the subacromial space below this acromion. You can see in here this bursa, a flat membrane that acts as kind of a shock absorber, a friction reducer. And then one of the 4 rotator cuff muscles goes through there. It's called the supraspinatus. That is the area where most of these shoulder issues occur. And this is a unique area because in this area, there is a zone in that tendon that gets really poor blood supply called the zone of avascularity. That space in the subacromial region is not very large. And it shrinks actually when we lay down. So think about already having some inflammation in that shoulder, then you lay down and those components come together, even without turning and laying directly on your shoulder, which would create more compressive force on those tissues in that area. It's going to tell you that it hurts. And I also want you to understand that the shoulder, like every other joint, every other body part, is a 3-dimensional being. So it moves up and down in the front sagittal plane, up and down in the frontal plane, and it rotates as well. That's going to be really critical when we talk about the causes of these shoulder pains. When we talk about types of shoulder pains, I'm not talking about causes. I'm just giving you a description, a diagnosis. Many different things can cause the same type of shoulder pain. What we're going to go through, and it's kind of interesting because all three of these things are interrelated and kind of different stages of one continuum of change over time. We're going to talk about osteoarthritis. It's the most common, more commonly known as just arthritis. But you may have been told that you have joint space narrowing in your shoulder, some bone on bone because of loss of that material in that joint space. That's really, really common. It's the most common one, actually. That can create a pinching sensation in the shoulder that's known as impingement. We'll talk about that in a little bit too. Then we're going to talk about progressive strain and tearing of the rotator cuff muscle and tendon, mostly the tendons as well. Let's start with arthritis. I think it's really important for you to understand, first of all, that arthritis has no nerves. And so degenerative changes affecting the cartilage will not be painful. The cartilage is not a source of pain, not directly anyway. Now, it might be a sign that there's compressive forces that are beyond what the shoulder is intended to handle, and that can create irritations at other areas, not just the cartilage itself, that are innervated and therefore can create pain. This also will, in most cases, create a healing response that can eventually lead to osteophyte formation or bone spurs as well. But here's the deal. You can get pictures taken of your shoulder, X-ray, MRI, and then hear a lot of scary words that make it sound really bad and actually, in all reality, make us more likely to have a failure of outcome with this. But I want you to know that amongst 40-year-olds with absolutely no shoulder pain, if we did an MRI on that group of people, almost 90% of them would have evidence of osteoarthritis. Osteoarthritis is as normal as wrinkles on your skin. If you do not have osteoarthritis at your shoulder and many other body parts, and you are 40 or above, you are absolutely weird. It's perfectly normal, okay? And we get concerned because we see these bad words and think that's not the way it should be. It's actually very normal. And most people with no pain have this stuff too. So don't concern yourself too terribly much with this. On the left side here, we're seeing impingement, okay? So impingement is soft tissues between bones getting pinched, irritated, and swollen. Okay, so what we see here is one of those four rotator cuff muscles called the supraspinatus. It turns to a tendon, travels through that subacromial space, and connects to the head of your humor, so that upper arm bone. The role of that supraspinatus tendon is, as we raise the arm overhead, it's helping spin the ball on the socket. So this shoulder is kind of unique. Our hip is a ball and socket joint, but that's a really deep socket that the ball fits neatly within. The hip can move in all different ways, 2-3-dimensionally, and quite a bit, but it is nothing compared to the degree of range of motion of your shoulder. And the supraspinatus has to keep that ball centered on the socket as we reach through space so that it doesn't wedge upwards and create mechanical pressure on those soft tissues that, with enough repetition and time, creates an inflammation and swelling response, and that is painful. Okay, so you can see that thing's not doing its job. The arrow is going up, putting pressure there instead of this arrow rotating to spin the ball on the socket. That is the primary source of impingement. And with bad mechanics of the rotator cuff and more impingement over time, there's going to be more irritation. And that leads to the proliferance of damage to this tissue that can eventually turn into small to larger tears of the rotator cuff tendon. We'll get to that in just a little bit. But first, I want you to understand impingement happens with a lot of people. It's a result of inflammation and swelling from mechanical friction. It's really hard to see this on diagnostic tests. They might see some evidence of some swelling, but it's not like you can see specific damage on that. It's very treatable if you give it the right kind of care, both with regard to reducing symptoms and then enhancing the movement efficiency of all of these parts of the shoulder. It does not require shoulder. And if you have, in particular, nighttime pain, impingement is the most likely issue that you're dealing with. Now, don't hear what I'm not saying. some pressure on those tissues are completely normal. The body is created and designed to handle some of that pressure. The issue is when you have too much pressure over a long enough period of time. That is the definition of cumulative trauma. Little changes below the symptom threshold and then eventually above the symptom threshold. I can feel it a little, it's not too bad, but over time it becomes more frequent, more intense, longer duration. So for those of you that have said, I've been dealing with this for 6 to 8 weeks or maybe 2 or 3 months, if you think back, do you ever remember tired shoulders? Do you ever remember it's a little painful, but not that bad kind of a thing? Because if so, you are probably dealing still with a cumulative issue. That is for sure. The next stage with enough of this inflammatory stuff over time is that the tendon itself will become inflamed, irritated, swollen, strained, and then with enough time on the same kind of mechanical stresses that have caused the inflammation, eventually that tissue can wear out and create a partial to full tear. Now, the tear becomes massive when its longitudinal or horizontal degree is greater, and when that muscle starts to retract from its insertion point. That's what tells you it's more massive. But again, remember, this is just one muscle, and there's a whole lot of other muscles connecting to the shoulder and a whole lot of muscles connecting to the shoulder blade. In fact, we'll talk about that in a little bit. Believe it or not, there are 21 different muscles that connect to your shoulder blade directly or indirectly. It's a really important part of your shoulder function. For a moment, though, I want to just talk about rotator cuff strain here. And I also want you to understand that there are tons of people walking around with strains and or tears that don't even know it because they don't experience pain. 60-plus-year-olds with no shoulder pain, if they do an MRI, 54% of them are going to have evidence of a tear to some level, small to moderate to minor, more significant. Let's see. Oh, under age 60. That says even those under age 60, that's pretty common. 1 in 3 without shoulder pain have some level of rotator cuff tearing. There was also a study done, I don't know, 10 years ago or so, where they had people with shoulder issues have an arthroscopic surgery. Half of them, they did some repair or cleanup work. The other half, they didn't do anything. And they found that outcomes amongst those that had the real surgery versus those that had the sham surgery were no different. So my point is this. Your MRI can be lying to you. It might tell you there's changes that have occurred. Those changes are not necessarily correlated directly with your symptoms. We also have to understand that those symptoms are the result of mechanical stress. It's a movement issue. You can solve movement problems without a surgery. In fact, outcomes are better without the surgery in most cases. And these realities of finding funky findings with MRI or an X-ray are not just limited to the shoulder, every body part. These are asymptomatic people with no back pain, knee pain, hip pain, shoulder pain, neck pain that have evidence of changes. And we're led to believe those changes aren't good. They're the result of problems. Well, they're kind of pretty normal. So my point is this. Pathology and pain are not the same thing. Never treat pathology. Always treat the pain and understand the pain is the result of a movement issue that needs a movement-based solution. What then are the real true causes? I'm glad you asked. We're going to get to that right now. I didn't leave any suspense with this, but you can see it all right here. I want you to understand that every body part, as I said earlier, moves three-dimensionally. We are made to move. It's good for us to move. The solution to pain is not don't move. Don't move leads to more significant issues over time. Movement is very good, but movement needs to be balanced. We need body parts that have a balance between mobility and stability. Sometimes people have way too much mobility, not enough stability. That's an issue. Okay, that's problematic on one side of the continuum. On the other side, we have some people that are way too stable and not nearly mobile enough. That's not balanced. We want to balance between mobility and stability at all links in your chain of movements, your kinetic chain. That is most stability, mobility and stability combined and balanced. And your shoulder will experience stressors if the closest neighbors are not taking care of business. The thing that hurts is the thing that's experiencing stress over time, but it's not necessarily the cause of that stress. A movement dysfunction at another part is most likely to blame for this. And the most common culprits for these movement dysfunctions external to the shoulder are the shoulder blade. We'll talk about that very soon. Believe it or not, your hips. There's a connection between hip movement, stability, and dynamic mobility. and shoulder function. And then your thoracic spine, the mid to upper back and your rib cage, all very important to have most stability, mobility, and stability. Let's start with the shoulder blade, okay? So your shoulder blade, it's interesting. The only connection of all these bones that make up your upper extremity, from the hand and wrist bones to the forearm bones to the humerus, your shoulder blade, the collarbone, the only bone-to-bone connection to your body is through the collarbone into the sternum. Your shoulder blade is kind of riding on your rib cage, and it's attached to the rib cage through muscles, but it doesn't create a true joint, bone-to-bone joint. So that floating shoulder blade on the rib cage is exceptionally important. As I said a little bit ago, there's tons of muscles that connect to the shoulder blade. So that shoulder blade is being impacted by a lot of different mobility producers. And for that shoulder to function well, the shoulder blade needs to dance well with the upper arm bone. I'm going to show you a very, very interesting computer animation of that in the next slide. But let's first talk about this. When you take about your arm from your side to overhead, that's a half a circle. That's 180 degrees of motion. Some of that motion is happening because the humerus or upper arm bone is moving on your shoulder blade, but not all of it. A third of that motion, about 60 degrees, occurs because your shoulder blade rotates as you raise that arm. So you can see the dotted lines in the bottom right here are the starting position of that shoulder blade. And when you get it overhead, the bottom angle is rotated upward that way. That creates about 60 degrees of the 180 degrees of movement. And we get a lot of people that have really bad shoulder blade mobility. That thing gets stuck. And again, when you hurt, you just don't move as much. And when you lack movement, the body becomes what the movements we do tell it to become. That shoulder blade gets locked down and you start to raise the arm, that humerus is going to lift and start pushing against that subacromial space. And that rotation of the shoulder blade doesn't occur to allow it to dance and reduce pressure in the subacromial space. So let me show you this right here. What you are seeing here is just the skeletal view from a couple different, well, actually, I think we're going to stay at this angle. But this gentleman or more woman, I don't know what it is, when the arm raises in different planes, you're going to see scapular reaction, shoulder blade movements. And it's amazing how much the shoulder blade moves. What I want you to focus on is this gap between the top of your upper arm bone and your shoulder blade. You see that semicircular shape there, that black gap, okay? The movement of your shoulder blade has to move with the upper arm bone to prevent those things from banging together and impinging in this area. So I'll talk you through this as we watch this. Oh, great. Here we go. So I think they're going to lift this up to the side first. You see how much upward rotation is occurring. This is like the doing a angel in the snowman, right? That's a massive amount of upper rotation of your right shoulder blade, maintaining that joint space between the upper arm bone and the shoulder blade, coming back down. Then I think next, this person raises it up in front only to about 90 degrees or shoulder height. And you're going to see some other movements, the shoulder blade to kind of dance along. Good. This creates retraction. Movement of that shoulder blade away from the thoracic spine. Okay. And I think the last one after it comes back down is the person reaching kind of to their back behind the hip extension. You're actually going to see the shoulder blade push towards the thoracic spine to the point where it almost overlaps with the spinous processes on the thoracic spine, all of which allows the upper arm bone and the shoulder blade to maintain a little distance between, in that subacromial space. Good job. There we go. Got it. All right. So the point is that the shoulder blade doesn't move well. It's not going to stay in concert with that upper arm bone. You're going to get some pressure on that subacromial joint space. At the start, you won't even know what's happening because it's below the symptom threshold. When that tissue takes on enough stress, more significant stress than what it's designed to accept for a long enough period of time, little changes occur. And the first sign, you get a little bit of ache and pain. little stiffness, a little soreness, but you recover. But with continued exposure to the same stressors, because you have not fixed the shoulder blade movement issue, eventually that symptoms will become more frequent, more intense, longer in duration. And so the question is, are there tight muscles that are preventing this thing from moving? Do we need to loosen that shoulder blade up? Maybe it's related to the thoracic spine, which drives the shoulder blade motion. That leads us to something we're going to talk about in a few slides. Let's first talk about the hips. You can see all these fascial bands from a front view and a back view that connect right hip to left shoulder and left hip to right shoulder. There's a strong connection between movement of one hip and the opposite shoulder, believe it or not. And think about this. I'm a big baseball fan. Let's say a baseball player hits a ball into the gap. Right fielder and the center fielder are converging into the right center field gap. The right fielder gets to it. Let's say the rule is in baseball that you can't throw off your feet. You got to throw from your bottom. How far is he going to be able to throw that thing anchored on his bottom? And it's not going to work very well. What happens is he plants his foot and engages his leg, and that engages his hip, and the hip leads to the movement through the arm. And we get this whip effect. Every ounce of speed and that gets translated into force and motion of that ball started with the ground's contact of the foot and then comes up through the hip, which drives and gets the trunk, the shoulder blade, and the arm moving. Any limitation in hip mobility in any one of the 6 directions, 3 dimensions in both directions, can give additional stresses to the shoulder, which cumulatively create issues. So you need to clear hip-related issues. The thoracic spine is really important too. So remember, I talked about a balance between mobility and stability. Your thoracic spine is a little bit unique. It is exceptionally rare. It can happen. I've had 2 adolescent girls that did gymnastics who had overly mobile thoracic spines. So it can happen. It's not common. Almost everyone is locked down at the thoracic spine. That changes the orientation of the head, the stress on the shoulders, the angle of the shoulder forward, putting more pressure into that subacromial space. Gravity, you can tell, is taking over. Shoulder blade doesn't track as well. You get stuck, and we get that impingement that can create inflammatory response and eventually progressive wear and tear that creates a slight and eventually worsening tear of the rotator cuff. Okay. Any limitation of movement through that midsection, which is pretty common, will reduce the efficiency and effectiveness of the shoulder blade and its ability to create a functional reaction through the arm at the shoulder itself. The bottom line is this, folks. If you have had shoulder issues and you sought help and they've only looked at your shoulder, they haven't looked at how the shoulder blade moves, how your hips move, how your thoracic spine moves, how all these parts work together, you have likely missed one or multiple issues that are creating this mechanical stress at your shoulder. And when that mechanical stress happens over and over again, you're getting an inflammatory response. That hurts. You're tempted to take an anti-inflammatory, which might make you feel better, but does not solve the movement-related issues. So it will not be at all a surprise at this point in tonight's workshop for you to hear me say, if you really want to truly and successfully treat the pain long-term, you have to get to the root cause, and the root cause is a mechanical issue. And I want to apologize. I'm part of a system that says in Western medicine, we look at things in a box. Okay, I can see there's inflammation there. We have an anti-inflammatory. This is just the way we're trained. But I'm here to tell you the most common treatments, anti-inflammatories, injections, and surgeries, none of them get to the root of the movement problem. You just kind of treat symptoms. And don't hear what I'm not saying. It's okay to treat symptoms. Feeling better is good. But if you want to get resolution that is not just a short-term pain improvement, you got to deeper than that. You got to get to the root of that movement issue. So successful treatment says, I've looked at your body and how it works, and we found these dysfunctions, these limitations in this area and that area. And based upon those findings that are true about you, we can create an individualized treatment approach that says, if we do this, we're going to take stress off that. And that's ultimately going to give you the best chance at managing your discomfort. That issue is not just shoulder specific, it is whole body focus. We have to recognize that we exist between gravity and the ground. And like Ezekiel said, your ankle bone's connected to your leg bone's connected to your hip bone, and all those things, the entire chain of kinetic movement has to be taken into account. This process Number one, it should be done one-on-one. We're allowed to do group physical therapy. We don't do it because it's not very effective. It's also very educational and empowering. And what I mean by that is you're going to be taught things that you need to do today, but when your body changes, you need to change things. So that's why you can't look up what are the 4 best exercises for rotator cuff issues, because different times uh, you'll need different activities. And depending upon what your true cause of that rotator cuff issue, the exercise needs to be um, fashioned to that particular root cause. And it's okay to do hands-on stuff. I do quite a bit of hands-on stuff. And I put people on a table and I help them move that way too. But ultimately, that doesn't do much good unless eventually you're getting a person on the feet and helping them move in real functional movement patterns between gravity and the ground. That manual stuff, hands-on stuff, has to be combined with true movement and real functional activities. Now, like I said earlier, hopefully you nodded your head a few times and said that makes total sense. But I don't think we solved all the world's problems. First of all, you're not going to memorize all this stuff. And second of all, as I said earlier, you know what some common culprits are, but you don't know what your culprit is or what your culprits are. There's a little hint. Many times, most of the time, we see more than one issue in people. Okay. And even if you did know, we like to say that knowledge is power. It really isn't. Possessing knowledge is only effective if you can put it into practice. You have to be able to implement it. So that's why I want to offer to you this natural shoulder pain relief consultation. It doesn't take long. It takes about 20 minutes. And by asking a few questions and doing a few simple assessments of those most common root cause movement capabilities, pretty quickly we're going to be able to figure out likely what the type of the shoulder issue is, what the true cause of those issues are or causes might be, and then what a natural solution to make it move better, mechanical, dynamic, functional approach would look like. You're not going to get all the answers on day one because things change over time, but I think you will on day one gain some confidence, understand direction, and give yourself some hope. So there's tons of benefits as I used to be pretty shy about this, but now that I've been practicing almost 3 decades, I have seen so many people waste a lot of time, energy, and ultimately money on things that don't get to the root of the problem. So I really want to encourage you to learn how to take control of your own health using a natural approach and doing this without, having to go through high-risk procedures or deal with the side effects that are really common in medications that may not get to the root of the problem, do not get, in most cases, to the root of the problem. You need a unique solution to your unique problem. Now, the good news is, though this does have value, it's about $150 in the open market. We're not going to charge you anything for it. It's absolutely free. And I'm telling you here, on the grave of my grandparents, it is not a high pressure sales tactic. It is informative. We tell you what that would look like. And from that point on, it's up to you. Do you want to move forward? Awesome. We'd love to help you. If you don't, let us know if it's ever right for you in the future. That is our approach. I can't give you a money back guarantee because I'm not taking your money, but I will tell you this. If you do it and you say, that was a waste of my time, we will give to the charity of your choice $150, which is the value of that time. Now, I'm proud to say that I've never had to give $150 to a charity for this purpose. We love supporting charities and we do that, but we've never had someone go through this and said that was a waste of time. It is exceptionally valuable, and the best thing is it costs nothing to you. At the very least, you're going to have a summary and an understanding of your issue that you can take with you when you go out. So here's what I'm going to ask of you. First of all, well, let me do this first. The simplest way is if you'd like to go see one of us, shoulder pain experts, just say I'm in. Hit that chat box and say I want to do it. And then you also have to tell me where. So we've got 9 clinic locations. So what's closest to you? We've got Ames, Des Moines, Colfax, Newton, Pella, Oskaloosa, Albia, and Centerville. So I'll say that again: Ames, Des Moines, Colfax, Newton, Pella, Oskaloosa, Albia, and Centerville. So if you want to do one of these screens, all you got to do is say I'm in and tell us where. Now, I also promised I would give you my contact information. Any of the emails that you've received after signing up, registering for this event, you can respond to that. That goes to Tassie, who's the one that replies to you when you signed up, and she'll get it to me. So that's fine. But Troy VM at Kinetic Edge PT gets right to my inbox without going to her. That cell phone number is there too. Even if you're not ready now, I want to be a resource for you. So you can call me, text me, whatever works best. Okay, we got a few coming in here. Let me say this. Oh, sorry, I missed a few of you that said something. Reaching out to the side and 2 years and up for candy, it looks like. Cortisone shots, said Joy, helps for about 2 months. Yeah, so the cortisone shot's going to make the inflammation better temporarily, but when the mechanical stress returns, it builds it back up again. So that's good. Let's see. Candy says she wants to be seen in Pella. All right, Candy. So when you signed up, if Candy is your name, we'll have that because I think you gave us some contact information when you signed up. If Candy's not your name, reply and tell me what your name is. Joe says in Des Moines, James or Katie, sounds like you know our Des Moines crew very well. We'll send this to a person that makes a call and they'll know that James or Katie is your request, Joe, and they are both excellent at what they do. Let's see, we got Jim saying he wants to be seen down in Centerville. Jim, we'll get you seen there. Esther, you want to be seen in Ames? We will get you there. Good, Candy, thanks a lot. That is your name. Let's see, we got Peter. No, sorry. Yeah, Peter wants to be seen in Oskaloosa. That's great. Joy wants to get in Ames too. By the way, when they call, for those of you that want Ames, we have an Ames North location and an Ames West location. One's on Mortensen on the west side, one's in the north off Stang Road. I can't remember what that section of town is right now. I'm having a brain fart. Sorry. Let's see. Janet says Oskaloosa. Kathy says Des Moines. Good job, folks. By the way, when you're going to get another email either tonight or tomorrow. On that, there will be a link to sign up for a free screen. Okay, got you, and Pella, Lisa, and Des Moines. Thank you. Don't click that link if you've put your name on here already. That gets sent to people who will call you out within the next 24 to 48 hours to find a time that works really well for you to have that screen. So you don't need to reply to that. It does. I think it's going to have a link to this video. So if you want to watch it again, you can. I got a favor to ask of you though. If you know of others that have been dealing with shoulder pain for too long, send it to them. There you go. Somerset. That's what it is, Joy. North Ames. There you go. Steve wants to be seen in Ames as well. Yes, you're welcome, Joe. Appreciate it. Let's see. I lost my train of thought with that. So you can reply to that email. Oh, yeah. So if you know someone that has shoulder pain, send it to them so they can watch this too. We would honor that same free screen. We want people to have real, true answers. So you could do us a lot of good by helping us that way. And yeah, if you have any questions at any point in time, you know how to get a hold of me. At the very least, I want you to see me and Kinetic Edge as a good resource for you. Maybe the time's not right for you now. That's fine. That's great. We are ready when you're ready. And we love nothing more than to help people figure out solutions that matter to them. Transforming lives and restoring hope through movement. That's our goal. Folks, I really appreciate your time. I know it is precious. I did pretty well, 52 minutes. So we did it pretty well here tonight. It's not just a platitude. If you have questions, comments, concerns, reach out to us. We'd love to be a good resource for you to give you solutions that really work. Thanks for your time. Have a great night, and I hope your spring goes well for you too. All right, take care.